All right, so I'm here today with my partner, Dr. Dustin Reid, both from Restora Austin Plastic Surgery Center. And, I'm not in clinic with you, obviously, but I think that, we see a lot of similar patients. And I think, obviously, tummy tucks are one of the things that we both do a lot of. And I think for a lot of patients coming in, it's really confusing to them about what are the results of my tummy tuck going to be. And it really just depends on, obviously, where they're starting. And a lot of people think that their tummy is going to be absolutely flat after a tummy tuck, and that's not always the case.
Yeah, and it's very challenging to talk about that with the patient, particularly in terms, I'll speak for myself, where I don't want to hurt their feelings and say, you're not going to necessarily be skinny or have a flat stomach after this, because many times patients who have more visceral fat, the fat that's on the inside, they'll also have the kind of panniculus, the hanging tissue on the outside. Tummy tuck treats that incredibly well. And they have problems with skin irritation and infections and just having a hard time keeping the area clean, and it really treats that well. But if they have that visceral fat on the inside, they're still going to kind of have that fullness, particularly above the belly button. And it's hard to describe that to them, like, that's not going away.
Yeah, I agree. It's tough. So I thought we'd just look at a couple of these cases just to sort of show patients, just the different variations. So when I see someone like this, I feel like this is a home run.
Yep.
She's got lots of stretch marks, lots of extra skin. We're totally going to be able to remove all of that. And when we look at her from the side, we can see the diastasis. And you and I know, we can look at this and know that's really going to be flat. She doesn't
that
really.
Fullness is from diastasis, not from intra-abdominal fat.
Exactly. So not the separation, but the stretching of the connective tissue between the two muscles. So this is just a home run. I love this. And then of course she has a fantastic result. Super low scar, small belly button, and she looks great. And this is a fairly early result. She's going to get, she's still a little bit swollen.
And it's worthwhile to discuss that too, because it's not uncommon. Where we repair that diastasis above, this looks to me like a 6-week result.
It is.
You see that swelling above where we repaired, I would say 90% of the time, and it takes some reassurance. Yeah, that is going to go down, and it is going to go down in this patient.
Yeah, absolutely. And then this next one, a little bit more fat on the outside, but also a really great tummy tuck, because you can look from the side and see, that's a lot of diastasis and that little hanging skin that we were talking about earlier. And again, like, she has a really great result, really flat. She had a little bit of liposuction posteriorly. So, these are easy. These are home runs. This patient is actually a skinny tummy tuck. Her issue is she's had 3 C-sections in the past, back to back, like literally 18 months apart, 3 of them. And 2 of them were emergent. And I think in one of them, obviously, she had some damage to the nerve supply to one of her rectus muscles, because she has a bulge on that left side. And so, she comes in, she says, people ask me, when am I due?
I don't even ask pregnant patients
No.
when they do till basically they're in labor.
Because
Yes.
she's really a thin person. Look how tiny she is, and she still looks pregnant. So we did a tummy tuck on her, and she still kind of has a little bit of that bulge there, and it's because her rectus is deinnervated a little bit on that side. And she just says it's really hard for her to contract that muscle on that side.
And by deinnervated, you mean the nerve has been damaged, and therefore that muscle never really works. We used to see this in patients after breast reconstruction using their rectus muscle, and it's so very challenging to treat, and you can't just tighten that.
Right. You can't tighten it because the nerve isn't sending the signal to the muscle to fire, to contract.
Right.
So it's partially not functioning normally. But I would say, it's a massive improvement, but it's not completely flat. And then you have patients that come in like this.
Right, and it's not uncommon for me to see patients like this. And, her complaint or her problem is she has this area of stretch marks after pregnancy. She had probably a C-section, and now she has this overhanging panniculus that you can imagine enclosed drives her bananas, and she wants it gone. And she would also like to have the rest of her abdomen be flat. But if we look at her from the side, that is intra-abdominal fat. That's visceral fat up above. Yeah. And that's going to be slightly better because she probably has some diastasis too, but she's still going to have that. And that, I always use myself as an example. That's the type of fat that I have, and really the only thing you can do for that is push back from the table. But if we want to treat that panniculus in many patients, that is their goal.
Right.
They're still a great candidate for abdominoplasty. They just have to know realistically what to expect afterwards, and that's why this talk's important.
Yeah, and I think, for this patient, I think you obviously did a 360 because this is her from the back, and that always improves things as well if you can really focus on that waist and trying to make them tinier. And obviously she looks so much better, but she's just not going to be, she's not going to be a size 0. She probably never was. And I think, one of our mentors taught us a long time ago, if you say something to a patient preoperatively, the exact same sentence, it's an explanation. And if you say the same sentence to them after surgery, it's an excuse. And so I think it's really important to just, find a way, again, not wanting to hurt their feelings, but just saying, like, you're just not going to be a size 2.
Right.
But you're going to be dramatically improved.
Agreed.